At our Strathroy Hospital, beds have been closed on half of the 4th floor. Many excuses are given. To state that the beds would not be needed is a blatant misconception of the truth. We need the beds for the chronically ill, palliative care, and rehabilitation. I have indirectly been told, and I use the term indirectly been told because I don't know if this is fact, that this past week, 2 nurses in Strathroy Hospital's Ontario breast screening program will be let go within the next few months and have received notice. The nurse educator in the hospital was eliminated, and it boggles my brain, how can a hospital get accredited without an education program? The fact few women have their babies at Strathroy has been interpreted that they prefer an obstetrician in the city. The reality? Few doctors choose to deliver babies, and Strathroy Hospital does not provide anesthetic after specific hours in the evening, so therefore there are no choices.
We've got a few introductions this evening before we kick off the meeting itself. I'm Shirley Roebuck. I'm a registered nurse. I'm an employee of Chatham-Kent Health Alliance. I work at the Sydenham campus in the Emerge. For now.
The distance to the Sault Area Hospital in Sault Ste. Marie is 55 kilometers from Richards Landing and over 60 kilometers from Hilton Beach. St. Joseph Island is over 40 kilometers long. Many residents, both summer and full-time, are more than 90 kilometers from the Sault. That's quite a trek for a person suffering a stroke, a heart attack, or injuries from a serious accident. March 27, Andrew de Tove, the Sault Star. We are told that there would be an $850,000 annual savings involved in shutting down Matthews Memorial Hospital. The hospital board has a $13 million deficit. That means that shutting down Matthews Memorial would only save 6.54% of the total $13 million deficit.
Thank you and good evening, ladies and gentlemen. Thank you so much for coming tonight. For those of you that are sitting here in this room, just let it be known that the banquet hall is completely full. The public skating room is completely full. The atrium is completely full. And there's still people trying to get in.
Other groups are watching very carefully to see what happens here. So I'm here speaking on behalf of rural physicians across this province who are very concerned about what this issue is. And you people here in Fort Erie are extremely fortunate to have such a solid group of rural specialists looking after you. But I wonder, will they stay without a hospital? I don't know. I don't know. But I am concerned about that. Those who claim there should not be 2 hospitals located close to each other forget that distance is only one part of a very complicated equation, and Dr. Kitts knows this. Population density, weather conditions, type of industry, the characteristics of the population all have to be factored into this. And don't forget the baby boomers, who are this generation about to enter their senior years, who will not hesitate to demand quality care close to home.
education and my health. I say no because I don't want to walk past people on the streets who have been denied their fundamental rights to health care as I go to work for a private hospital. I say no to privatization because I grew up in a Canada that values patients before profits, equality and human rights.
There's a lot of noise when we get on this march because today, the point of today is this. We are joining with 5 communities across Ontario. Today, at this time, they're protesting in Windsor, they're protesting in Kingston, they're protesting in Sudbury, and they're protesting in Thunder Bay. And we are joining with thousands of people who, like you, have bussed in from their towns where their emergency rooms are being closed down, where they're moving birthing out of town, where they're moving the mental health beds out of town, where they're forcing patients to drive further and further for services. And this is critically important because if we join up every small town and large town in Ontario that's facing a hospital cut, there will be no choice but McGuinty has to listen. So far, we're facing the biggest round of hospital cuts that we have seen since the mid-1990s, the biggest round of hospital cuts that we've seen in a decade. And the Premier has yet to even comment on it publicly in the media.
Solidarity forever, and ONA makes us strong. Woo!
Yeah, because there's a hospital right there.
Nurses care for healthcare. Who care for healthcare? Nurses care for healthcare. Who care for healthcare? Nurses care for healthcare. Who care for healthcare? We have censured this employer as being one of the poorest employers in Ontario for our members. Shame. Who cares for healthcare? Nurses care for healthcare. Who cares for healthcare? Nurses care for healthcare. Who cares for healthcare?
So this group of concerned citizens is here today. We are participating in the Ontario Health Coalition's call to action. The Ontario Health Coalition wants all of the MPPs and Dalton McGuinty to know that the Ontario voters are not going to stand for small community hospital downsizings and closures. We deserve health care. Anyone in this province deserves equal access to survive a critical illness or injury.